The scale of the HIV/AIDS epidemic has exceeded all expectations since its identification 20 years ago. Globally, an estimated 40 million people are currently living with HIV. Some 20 million people have already died. The worst of the epidemic is centered on sub-Saharan Africa, where 26 million people are currently infected. Just as the spread of HIV has been greater than predicted, so too has been its impact on social capital, population structure, and economic growth. Over the years, AIDS patients have been stigmatized in greater society, making it extremely difficult to provide both short-term and long-term solutions to their health needs. HIV/AIDS is a key business and developmental concern, with various sectors grappling with the challenges it poses. Nothing less than a sustained social mobilization is necessary to combat one of the most serious crises facing human development. The war against HIV/AIDS has today taken a new dimension following the active involvement and participation of key players from both the private and public sectors. The International Committee of the Red Cross is aware of the significant impact of the HIV/AIDS pandemic on its national and expatriate employee and their dependents as well. By 2003, the Icrc management realized that in order to maximize on the potential of each employee, it was important that they were as healthy as possible for the length of time they worked for the organization. There was therefore a great need to demystify the mystery associated with HIV/AIDS, thus enabling employees to coexist, interact, and share information freely, enhancing their chances of living a healthy and rewarding life.
People would expect that to treat your staff, to make the prevention available, make voluntary counseling and testing available, and then to treat your staff would be, in terms of business, a heavy cost. The fact is, it's good business to take care of your staff, because you will pay much less if you put your staff on ARV drugs, and if you allow them to be well. You save in training costs, you save in health costs overall, and you have a staff which is regular with you, rather than to have a heavy turnover.
The organization has adopted an HIV/AIDS policy which will ensure that all Icrc employees working at headquarters or in the field, whether national or expatriate, including their dependents, have full access to effective HIV/AIDS preventive care and medical treatment. The day has just begun at the Icrc Logistics Center. From here, logistics and operations for the Horn of Africa and the Great Lakes region are planned and executed. This is the home of one of the world's largest relief operation centers. Repairs for all the vehicles are also carried out here. Every member of staff here counts. The Icrc values them and cares for their welfare and that of their dependents. It is a busy morning at the workshop as Zachary Ondieki and his team prepare for the day.
Okay, now, service.
The team is highly motivated and keen to move with the day's work. Without clear-cut workplace policies, HIV/AIDS has the capacity of destroying such skilled human capital in a relatively short time. Paul Kimani has worked for Icrc as a truck driver for over 10 years.
My job in Icrc is transporting relief supplies from point A to point B. Point A is like from Nairobi. Point B might be either in Kampala, Lubumbashi, or Bukavu in Congo, Burundi, and sometimes even in Ethiopia.
His life on the road has taught him serious lessons on how the HIV/AIDS problem spreads. HIV/AIDS is in some way an occupational hazard for long-distance truck drivers.
When you are traveling, sometimes it takes you about 14 to 21 days. The sight at night is kind of worrying because of the nightlife that goes on there. You find little girls drinking beer, and what comes out of that is something you don't even want to imagine. So we see quite a lot of bad things happening where we actually spend the night.
The AIDS virus is spread over most of sub-Saharan Africa, partly due to the Trans-African Highway. Does Paul remember losing any of his colleagues to AIDS?
Yeah, for the time I've been working with Icrc, I've quite lost a number of my colleagues through HIV scourge. And really, by then, it was like you don't even want to talk about it. It was like a beast. Even if you hear a friend of yours has gone down because of HIV, you don't even want to go and bury him, fearing you might even be affected by the soil.
Many companies are today adopting a workplace HIV/AIDS policy. They are encouraging workers to take interest in knowing their status. Some already provide counseling and also have an antiretroviral dispensing regimes. Icrc recognizes the fact that you cannot run away from the problem of AIDS at the workplace.
Doing any business, including humanitarian business, in Africa and for the matter in other places heavily affected by HIV/AIDS, you have a moral, a human, an ethical dimension where you just cannot ignore that you're working in this environment, and that you cannot ignore that your people are suffering, that part of your staff is not well.
Towards the end of the 90s, we lost a couple of quite a number of staff in our Lokichogio office, and then we realized that a lot of people were going into hospital for a very long period of time, and already we knew about the antiretrovirals. So the medical office, plus help from HR department, we did a study and showed the management that people on ARVs, who some had already started without being paid for, they are spending less time out of hospital and more time in their workplace.
The Icrc policy for its staff all over the world is based on the International Labour Organization's Code of Practice on HIV/AIDS.
I think to a degree it is still important to ensure that everybody understands that HIV/AIDS is not a disease which stops in any way at cultural borders, that we are all concerned in the same way and to the same degree. That particularly a multicultural working environment with cross-cultural approaches has to take up issues such as this one. There are many others as well, but issues such as the one of HIV/AIDS in a way where people do not feel that it is for one group of your staff important and not for the other group, or that you're somehow protected from it because you are coming from outside Africa and living here.
HIV is one of those issues where you always think that it doesn't affect you. So it's somewhere else, it's somebody else, and I think this policy really helps us to make us aware of the fact that it can touch everybody, anybody, and we think about it even when we're at work.
The concern comes into sharp focus when one considers the impact of HIV/AIDS on the production capacity of a workforce. There is increase in absenteeism, increased labor turnover, declining morale and loss of skills and knowledge, higher demand for recruitment and training, declining intellectual capital and reduced labor pool, rising costs associated with insurance cover, retirement funds, health and safety, medical assistance and funeral costs, increased operational costs as a result of declining reliability. An HIV/AIDS committee is operational. Under this committee, there are several other committees, such as the peer educator teams. It implements the policy and is answerable to the head of delegation. Interest from the top leadership of the delegation is a good indicator of the seriousness the organization views the HIV/AIDS pandemic.
I joined this program because I wanted to learn more about HIV and AIDS. how to address it, how to be open about it, especially now that in Kenya people don't speak about it so much. Especially, and since I find the youth very active when it comes to matters of sex, how I can be able to talk with them about this. More so because I have 3 young children. I wanted to know how I can approach them, how I can bring up the topics in a way that they can understand.
What do you see about yourself? Your self-image. What do you say about yourself? Do you need to change it or do you not need to change it?
On a regular basis, discussion groups meet to have open talk regarding the problem of HIV/AIDS. This forms part of the awareness, education and prevention program.
I think sex is one of those things that it's really your business. You are accountable for your sex life more than besides being raped. The rest is really pure, straight choice.
And also in a relationship, there must be trust.
I think it starts with the way we communicate. Because if we are not communicating, then I think we will not get anywhere.
Priority is given to this program because if one can avoid getting infected in the first place, the family, employee and organization will have been cushioned against heartache and high costs respectively. The peer educators also distribute condoms at no cost through strategically located dispensers.
The last one and the most important is the self-esteem.
The information and strategies then trickle down to regular talk shows that bring staff together for open discussion on HIV/AIDS.
The different activities we do, like the talk shows and just information sharing, people have become a little bit more open. People are able to talk more openly about HIV issues, about sexual issues, things that were not so easy to talk about. People are able to be a little bit more open about them. And that helps because when somebody's in a problem, it means they are able to actually seek help.
The Icrc HIV/AIDS policy gives the roadmap on how to manage problem through 3 basic policy principles: fair employment practices and confidentiality, education, awareness raising and prevention, care and treatment. In many instances, lack of awareness and understanding of HIV/AIDS results in fear and negative attitude towards the infected and affected. The Icrc opposes all forms of discrimination against its employees.
Your staff has to trust you that you will never want to know whether or not they're HIV positive, and you will never make your decisions regarding them staying or not staying with you or joining you or not dependent on whether or not they're HIV positive.
This information is purely between healthcare professionals. It doesn't reach the management. And they have no forum to address. They have the mandate to deal with me in terms of the health needs of these people, either in terms of medications they'll require or any other clinical care that they require. The organization agreed on their proportion in terms of payment without further inquiries. What are we paying for?
We receive medical bills and they all come in like any other bill. They come in through our reception. It's not that they are collected by our nurse. So they come in through the reception. The normal procedure is they are registered at the reception. They come to our department. We register them, we process them, we send them to the medical department, who in turn approve them and send them back to us for payment. However, they do not attach the details of the ailment. By this I mean there is no prescription, for instance, attached to the bills. It's just the fee.
The beginning of the journey towards a healthy existence for everyone is taking the HIV test at the VCTs. The Icrc HIV/AIDS policy encourages employees who have not done the test to do so in order to live a life devoid of doubt. During the counseling session, the counselor gives the client information about HIV/AIDS and the process and clarifies any myths and misconceptions that the client may have. All VCT providers must be trained in VCT and service delivery according to the approved national VCT guidelines. Sample collection involves drawing of a pinprick of blood from the client in readiness for the test, which is done by a licensed laboratory technologist. The results are available within 20 minutes. In post-testing counseling, the counselor helps the client explore the meaning of their test result, whether it is negative or positive. The client is also advised of any referral and follow-up services to benefit either HIV negative or positive people. The Voluntary Counseling and Testing VCT program is available at no cost to all employees.
What we are trying to do is to offer to the patients a comprehensive treatment package, including, of course, antiretroviral therapy, which are more and more available, accessible in Africa. We are working with local counterparts. That means I'm not the one treating the patients, but we have tried to identify the best, the health structure offering the best care and treatment in the region.
Antiretroviral drugs slow down the HIV virus from multiplying, and therefore less viruses attack the immune system.
Since the number of viruses is very, very low in the body, the immune system starts to heal, to go back, let's say, to normal. And therefore, the patient does not face what we call opportunistic infections.
The Icrc peer educators provide staff with appropriate information through a graphic newsletter enabling them to protect themselves against the HIV/AIDS infection. The newsletter also communicates news on initiatives on the local and international level regarding the fight against HIV/AIDS. Other communication materials include pamphlets and flyers.
We had an increasing number of our staff over the last 10 years, a clearly increasing number of our staff becoming too sick to work or dying over time. And this is something, this is a tendency we clearly hope and start to reverse. On the other hand, we also hope that we will have the majority of our staff having gone through voluntary counseling and testing, and at the very least be aware of their status in order to be able to adapt their lifestyle then accordingly afterwards, to protect themselves better if they are healthy, and to learn and to be supported to live with HIV/AIDS if they have contracted it in the past.
Medical research has shown that early detection and treatment through ARVs considerably lengthens and normalizes the patient's life.
A few years ago, there was no treatment at all for HIV-infected patients. So big progress has been made with antiretroviral therapy. So now that means that HIV is not a death sentence. There is a hope, there is a life after for the people living with HIV/AIDS.
It's a program that has really sensitized the staff to understand the pandemic. It has helped me as an individual to a great extent, of course. I get to know how to relate to people who are suffering, either infected or affected.
AIDS is a reality, and it is an epidemic at the moment which we all need to look out for. And we all know that prevention is better than cure.
What is Paul's message to the people who find themselves in situations of dilemma, especially in situations regarding relationships?
Just have discipline. Know that you've got a responsibility behind you. You've got your family. You really want to see them grow old.
Icrc is part of greater society. Its operations span a vast part of Africa. Community involvement is critical if the HIV/AIDS policy is to work. It is the end of a busy day at the Icrc Logistics Center workshop. Zachary Ondieki winds up by telling his team that he values each of them and advises them to feel free to pick up condoms from the dispensers without inhibition, as they can save them from HIV infection. He urges those who are married to be true to their loved ones first and foremost. After all, they say prevention is always the best solution.